with respect to the KEYNOTE-40 study, which of course was a phase 3 trial in recurrent or metastatic head and neck cancer, it was based on the premise that anti-PD-1 shows single-agent activity in squamous cell carcinoma of the head and neck, and we knew that from earlier studies such as KEYNOTE-12 and from other agents that targeted this pathway. The response rate seems to be somewhere just short of 20%, and the feeling was that that would be an improvement over standard of care, especially as a single agent in patients with recurrent or metastatic head and neck cancer who had failed platinum therapy. And that's exactly the premise of the KEYNOTE-40 trial. Again, this was a phase 3 study that compared, in the experimental arm, Pembrolizumab as a single agent versus an investigator choice standard of care. That standard of care included either Methotrexate, Cetuximab, or Docetaxel, and this was an international trial. The trial accrued completely for over 400 patients, and with a primary endpoint of overall survival in the intent-to-treat analysis. In fact, what we saw was that the overall survival was improved with Pembrolizumab over standard of care with a hazard ratio of 0.81. However, it did not meet the pre-specified p-value to declare it a positive trial. So it delivered a 19% improvement in overall survival, but unfortunately a p-value of 0.02, which did not meet the pre-specified parameters. Having said that, it does appear that Pembrolizumab is active in this disease. It does appear that numerically the survival is improved. And perhaps just as importantly, when we look at the subsets of patients whose tumors express PD-L1, we see an even more marked improvement in overall survival. In fact, the higher one goes in PD-L1 expression, the more the survival benefit is extended. And in the very high expressing patients, the hazard ratio drops to almost 0.5. Coupled with that type of improvement in overall survival, we saw improvement in response rate, again, in the intent to treat analysis, but even more so in patients whose tumors express PD-L1. And the toxicity was quite favorable compared to standard of care, with the toxicity profile that we've seen in prior studies, immune-related adverse events, but at a very low rate, somewhere in the range of 10%, or a little bit higher than 10% when we look at the grade 3 or 4 toxicities. So the totality of the data from the KEYNOTE-40 trial would suggest very strongly that this is an active agent in recurrent or metastatic head and neck cancer. It does appear to be an improvement over standard of care, especially in patients whose tumors express PD-L1, and it appears to be a very well-tolerated agent in these patients.